I'm Robert Ernst. I'm the Chief Health Officer for the university. I also serve as Associate Vice President of Student Life for Health and Wellness. So the question is how to make an appointment for STI testing specifically. The best way is to call the health service, and if it's just for screening, meaning no symptoms and no concern about close contact, there can be a referral to a nurse who can issue a questionnaire and arrange for the student to go directly to the lab and have the testing done without a visit. Otherwise, if they want to meet with one of our clinicians, they can have that appointment made and meet with one of the clinicians, and the testing will be ordered at that time. The health service won't bill your insurance for these things. It's for privacy purposes. If a student has any of the most common STI labs ordered and performed here, there won't be any out-of-pocket cost and there won't be any charge to the insurance. We would only bill insurance if the students were between semesters or have just graduated. All of our records are strictly confidential. So the appointments themselves obviously are just between the student and the provider. The results come back to the student directly through the portal. So even if the students don't have a portal and we're not quite there yet to make appointments through the portal, it's important that the students have that set up for the fastest and the most private way to get the results. Most students probably already have a patient portal account. We use that to get students registered for care here at the health service. If they don't have one or aren't sure, they can contact our health information management team here at the health service. And there's a website that they can do this either online or over the phone. The STI resource guide is a chart that we're putting together. It's available on the UHS website that outlines the various types of tests that we would order. Some require a blood test and some are a specimen collection. The STI guide can also outline resources besides the health service where students can get STI testing. That can be at the health department or other clinical resources, and that may be more convenient for students if they don't live right on campus or if they just want to go to a different site. And UHS offers a wide range of services for students. You know, we think of our core work as being built around episodic care needs for students. That might be the common illnesses or injuries that students sustain, and we have a medical clinic for that and a quick clinic to offer same-day visits for those services. We also offer primary care and preventive care for students. Gynecology and sexual health is core work for us here, and we've been talking a lot about that with regard to STI screening. But we also really focus on musculoskeletal and sports injuries, and I can't underestimate and understate the importance of student mental health that we take care of as our core work also. UHS is conveniently located on Central Campus, directly across the league on Fletcher Street. Our hours of operation are 8 to 5 during the week, and we're open Saturdays from 9 till noon during the school year. After hours, health service has a 24/7 nurse advice line, so for students who have something that can't wait till the next day, they can always reach a nurse or a clinician after hours if that's important also. There's no extra charge for that.